treat this HER2 positive breast cancer? Well, so now you can imagine it like a warfare, okay? So you have weapons of mass destruction. You have your artillery guns, you have AK-47. That is our weapons of mass destruction, are our chemotherapy. Then afterwards you have some sniper weapons or some targeted bombing. That is your anti-HER2 therapy. So along with your weapons of mass destruction, when you add this sniper weapons, you get a much more very strong combination where you're able to target the tumor and kill it from its root. So you will of course be using the different modalities like surgery, radiation, and the chemotherapy part is what I'll be talking about. In the chemotherapy part or the medical oncology part, we would use a combination of chemotherapy drugs like either adriamycin, cyclophosphamide, and then taxanes like docetaxel or paclitaxel. These are the weapons of mass destruction. For your sniper weapons or the targeted bombing, you have the anti-HER2 therapy, that is trastuzumab and pertuzumab. These two are injections available in the form of injections. How does this trastuzumab and pertuzumab work? Like I had explained earlier, that on the tumor cell membrane, you have these HER2 receptors or growth factor receptors which are floating around. So you have a monoclonal antibody which is factory made, that is the injection trastuzumab, which comes and docks on like a receptor ligand. It comes there, docks on over there, blocks the receptor. It prevents the receptor from giving a proliferative signal. So therefore the cell stops to grow. The signal that is required for the cell to grow is stopped. Therefore, the tumor shrinks and the patient benefits. Trastuzumab and pertuzumab work in a slightly similar fashion, but although both are slightly different. Trastuzumab and pertuzumab work in a similar fashion, although both of them are slightly different. Trastuzumab acts on a single HER2 receptor, whereas the pertuzumab prevents the dimerization. That means to say the two HER2 receptors coming together, it prevents that. So both of them act on the same HER2 receptor, but there's a slight difference between them. So what therapy should a patient receive? If a patient has a locally advanced breast cancer, that is presence of a breast clump along with lymph nodes, but it is not spread anywhere else to the body, these patients would need chemotherapy. Along with that, they would need a targeted therapy. So we give a regimen called TCHP, that is the chemotherapy arm is docetaxel and carboplatin, and the targeted therapy arm is your trastuzumab and pertuzumab. So all of these four drugs, that is TCHP is docetaxel, carboplatin, trastuzumab, pertuzumab, all of them are given together for around 4 to 6 cycles. Then the patient undergoes surgery, and then subsequently if the patient has resolved well and the tumor has resolved well, not the patient, if the tumor has resolved well, and we call this something called pathological complete remission, that the pathologist can't identify tumor tissue in the breast sample, that is after receiving the chemotherapy, then the patient receives maintenance trastuzumab for a period of 1 year. In case after giving this particular regimen, that is TCHP, if there is a remnant tumor tissue, then these patients would end up receiving another form of trastuzumab. It's called TDM1 or trastuzumab emtansine. So this is like a nuclear warhead. You have a BrahMos missile, and then on top of the BrahMos missile you have a nuclear warhead also attached to it. So it causes more collateral damage. It has got much more penetrative power when compared to the simple single agent trastuzumab. So we use TDM1 in these patients. That is, after giving chemo, you do surgery, there is some amount of remnant disease. In that situation, you give TDM1 or trastuzumab emtansine to these patients for a period of 1 year. Now, what is the benefit of all of this? You are preventing the tumor from coming back again. You are preventing recurrence and improving longevity. We shall talk about survival rates of breast cancer in our subsequent videos. If you like this video, please do press the like button, share it and subscribe to our channel. Thank you very much.